Hello, welcome back to our YouTube channel. I'm Dr. Jenna Shivers, and this is Miss Mindy Moo, and we're here with the lovely vet. Thank you so much for tuning in. Today's subject is going to be on heat stroke in dogs. So an extremely important subject matter. It's extremely important you know the signs to watch for. It can certainly save your dog's life if you're able to start cooling before you get to the point of full heat stroke. So thanks so much for tuning in. As always, we have our timestamps throughout the video so you can scroll through to which parts you like. We're going to be covering kind of all basis around heat stroke in dogs. This is the fifth part of our cottaging and camping series. Let's get started. First real question is, what is heat stroke and how does it happen in dogs? So heat stroke is a condition where our dog's body temperature increases over the normal temperature zone. Our normal temperature zone in dogs and cats is 38.5 degrees Celsius to about 39.3 or 39.2 degrees Celsius. So when our dog's body temperature goes above 40.1 degrees Celsius, that's when we consider our dog to have heat stroke. That's when they start to show our signs of heat stroke, which we'll discuss in just a moment. And then when the temperature continues to rise, we get temperatures that are above 43 degrees Celsius, we really get into trouble. Our organs start to dysfunction. Our proteins start to dissolve, and we get lots of issues with clotting or bleeding issues, as well as multiple organ function. So that's really when we're in the danger zone and have that irreversible change. The next question is, how does it happen and why does it happen in our animals? So with humans, we have sweat glands. When we get overheated, our body starts to sweat to try and cool itself down. Our dogs don't have sweat glands except for just a few that they have in their little foot pads. Otherwise, they don't have sweat glands throughout their skin. The main way that they are able to get rid of that heat is through panting, and that's why you often see dogs panting in the summertime. There's different ways that dogs' body temperatures can increase. This particular case, it's caused by external factors, so heat in the environment causing the dog to become overheated. There are internal factors that we can see that cause, fever, like infection. We're not discussing that today. And I suppose there can be some internal factors such as exercise can induce heat stroke as well. So we'll talk a little bit about that. Heat stroke's most likely to occur with hot, humid temperatures, very little airflow, no access to shade or water if they're left outside, as well as excessive exercise, especially in our hunting or working dogs. And then animals that are just not used to the environment. So if you're traveling down south in the winter time, you're used to it being cool, you get down to your southern states and it's quite hot. They need some time to acclimatize to that hot. The kind of increased risk factors for the animals that are more likely to get heat stroke. The number one category of animals that get it are our brachycephalic animals. So that means our animals with the short noses. So any bulldog, pugs, boxers, even any of our bully breeds, Pekingese, even our short-faced cats like our Himalayans or our Persians. Are much more likely just because of the formation of their face, keeping that in mind with those breeds. Other things that are factors are any kind of breathing issues like tracheal collapse or laryngeal paralysis, heart issues, or cardiovascular issues. It's more likely to occur in animals that are really young or really old, animals that are overweight or obese, as well as really overly excitable and overworked kind of working dogs and hunting dogs in those hot, humid temperatures. The big ways to avoid heat stroking your dog are, number one, to avoid the hottest times of day with them being outside or out of climate control. So walking your dog in the early morning or in the evening when it's the coolest. Always making sure that your dog has adequate shade as well as access to free water all the time, even having a second water bowl just in case the first gets tipped over, as well as never ever leaving your dog in a parked car. Even with the windows open, there's very little airflow. And like I said, our dogs overheat way more easy than we can. And even in just as little as 15 minutes, we can see the heat stroke setting in. The other things that you need to keep in mind too is not only parked cars, but garages that are not climate controlled, houses that are not climate controlled can get quite warm when we're away. So here are some signs of heat stroke in kind of the order that they occur in dogs, and then we'll touch base on the same in cats because it can be a little bit different. So dogs, starting with your excessive panting, so that being, after your dog's exercised, oftentimes it takes them a few minutes to kind of calm down and breathe more normally. If that breathing, excessive panting continues and they don't seem to be calming down, that's your first sign. The second sign that we see is that the saliva becomes quite thick and starts pouring from the mouth. It becomes really ropey. The third sign that we see when we check their gum color, that their gums look almost like a brick red color. So quite a dark red color versus our nice pink gum color. The third thing that we see is they start getting sick to their stomach. So they start having excessive vomiting or diarrhea. And then finally, we get into our neurological signs. So they can become very disoriented. They can completely go into a coma or pass out, or they can start having a seizure. So this is kind of towards the end of our warning signs. In cats, it's a little bit different. And in general, our cats are less likely to get heat stroke, mostly because A, they don't really exercise when it's hot out. B, they do oftentimes seek shade and cool. So when we see cats in heat stroke, oftentimes it is a situation where they're left in a car or left in a garage and unknowingly. So with cats, we look for the signs of excessive grooming. So they're trying to wet down their skin to cool themselves off. They urinate less, which is kind of a hard thing to monitor, but certainly something to watch out for. The other thing that we can see in cats, if they're extremely hot, is open mouth breathing or panting. Anytime you see a cat with its mouth open, breathing, or panting, get them to an emergency clinic as quickly as possible. This is extremely unusual for cats, and it is not a good sign. So please get them in. There's lots of different causes of it, but none of them are things that should not be assessed by your veterinary clinic as soon as possible. And finally, as the heat stroke progresses in cats, we see all the same signs as we do in dogs. The open mouth breathing, the drooling, the disorientation, vomiting, diarrhea. So the big question is, what do I do if I think that my dog has heat stroke? First of all, call the closest vet clinic that's open as soon as possible. Let them know that you're concerned your dog has heat stroke and you're on your way. They'll let you know if they don't have anyone to see your dog or if you need to go to an emergency center or whatnot. The next thing is trying to get your dog to the emergency or closest veterinarian as soon as possible. While you're preparing your dog to get in the car to get to the veterinary clinic, and especially if you have a second person available, getting that dog cooled down as best you can. So it may sound a little bit counterproductive, but we want to use cool water, like tap water, versus cold or ice water on our dogs. The cold or ice water will actually constrict the vessels or make them smaller, which gets rid of less heat. So we want to use cool water. We want to rinse them down under their armpits, along their belly, and along their neck and groin area. And then we want to get them in the car. We want to roll all the windows down, put the AC on, and get as much airflow as possible to try and cool your pup down. The other thing that you can do if you have it handy is if you have an ice pack, you want to wrap it in a towel and stick it in the armpits or the groin area where we have our major vessels, that is going to cool the blood down a little bit quicker. We do not want to overcool our dogs. We have to be careful with that. We do not want to put ice packs on their feet. We do not want to put ice packs near their head. Just under their armpits and in the groin area is appropriate. We want to move our pet to a cool area, offer them water if they're wanting to drink. Do not force them to drink water. That can cause even more issues. These are very important things that we need to not do when we suspect our dog has heat stroke. Number one, we do not want to use ice water or an ice bath. We just discussed that. Number two, we do not want to use wet towels on our dog because those can heat up and actually insulate our dog. We do not want to overcool our dogs. We don't want to take them from a high temperature and then become a low temperature. We want to stop cooling them when they become into that normal zone. So 39.4, 39.3 is our normal temperature. Once that temperature is reached, we want to stop cooling. And please, please, please do not skip seeing the vet. It's extremely important. If your dog has had an elevated temperature for an extended period of time, there's a good chance that they could have some damage to their organs. It's really important to know that as soon as possible and start treatment as soon as possible if needed. If we wait, even if the dog appears to be normal after you've cooled them, they can die within 24 to 48 hours of underlying concerns that have been caused that you can't see from the outside. So please, please, please take your animals into the vet clinic if you suspect that they've had heat stroke. So what happens when you get to the vet? As soon as you get to the vet, your animal will likely go straight into the emergency treatment area. They'll start emergency cooling. They'll get an IV catheter in and start to rehydrate your dog, as well as controlling blood pressures, which oftentimes are influenced by our fluid levels. And sometimes our dogs will go into shock as well if they are quite severely dehydrated. They will likely use oxygen supplementation so that they can support the other organs. They will likely use a sedation, or sometimes they'll do a full anesthesia to put the dog out so that they can secure an airway, especially if the dog is in a lot of distress with breathing, or if the dog is unconscious to start. They will secure the airway with a breathing tube. They will definitely use medications to protect the gut, to avoid that vomiting and diarrhea and protect the gastrointestinal lining. They will give medication for pain control. They will likely give antibiotics to avoid what's called sepsis or bacteria going into the bloodstream. And then depending on the severity as well, if they have concerns with the heart or concerns with the blood pressure and they have had a really high temperature, sometimes they do have to supplement the blood by doing a blood transfusion or plasma transfusion as well. And then testing that they'll always test the concentration of the blood, see kind of what their hydration level's like, look at the organ values to see where they're at, and that gives them a good baseline to see where you're at when you're starting, and then they continue to check those levels every so often to see how the treatment is working and whether it's progressing positively, because that's a really good indicator of whether this animal will survive heat stroke or not. Which kind of brings us to our last section, which is what is our most likely outcome if our dog has had a heat stroke. So being completely open and honest, about 50% of the animals that come into the clinic with heat stroke will survive heat stroke. The ways to make that more likely for your pet is to start the cooling before you get to the vet clinic and to get them to the vet clinic as soon as possible. It's an extremely serious condition. It is an emergency. Don't wait. Don't hesitate. Get them there as soon as you can. They are the top of the list for priority. They're going to go straight into the door and get treated. If caught early enough, some dogs can have a full recovery. So that's what we want for your pet. If left untreated completely, the chances of your dog dying are 100% if their temperature has gone above 43 degrees Celsius. So please get them in as quickly as you can. The doctor who assesses them can discuss with you where they're at as far as progression as well as temperature, and you can discuss a case-by-case basis. But we really want you to recognize the signs early, get the cooling started before you even get to the vet clinic, and get them assessed as soon as possible, and that's the very best outcome for you and your pet. Thanks so much. We'll see you again next week. Feel free to follow along with our Instagram page at The Lovely Vet for daily tips and tricks on all things for your dog. And I mean, our primary goal here at The Lovely Vet is that we want you to live longer, happier, healthier lives together with your pets. So thanks so much for tuning in. And next week we'll talk about packing for your dog for going cottaging and camping. Thanks so much. Take care.